Friends, myself Dr. Tapas. Today I'll be teaching you one of the important topic, that is how to strengthen the neck muscles. So most of the times we used to treat lot of conditions, we physios, we used to treat lot of conditions which relate to the neck muscles tightness. But most of us, we don't know how to use a Thera tube to strengthen the neck muscles. So today we will learn few of the important neck muscles, mainly the extensors like trapezius, deep neck extensors, mainly the flexors, sternocleidomastoids, and the lateral flexors. Today we will learn how to strengthen these muscles. So the instruments which will be used, this is what's called as a Thera tube. So using this Thera tube, we will be learning how to strengthen the neck muscles. So before doing the exercises, one thing you need to understand that whenever a patient is having any type of tightness, we will be not doing these exercises, but only thing when the tightness is reduced, in case of any type of trapezial spasm, the tightness is reduced, then only we will be doing these exercises. So let us learn now how to do the exercises using this Thera tube. So the important muscles we will be learning today using this Thera to do the exercises, that is the trapezius muscle. So you know where is the trapezius. This is the upper fiber of the trapezius. We are having the middle fiber of the trapezius, and we are having the lower fiber of the trapezius. So now as of we will be learning these three muscles how to strengthen using this Thera. At the same time we will be learning the neck lateral flexors, that's the unilateral sternocleidomastoid. So we will be learning the neck lateral flexors, how to strengthen the same, and also we will be learning how to strengthen the neck flexors. When the bilateral sternocleidomastoid contracts, this will go for the neck flexion. So we will be learning this all the exercises. Now let us learn these exercises using this Thera. Okay, now you can see the Thera tube over here. What we will do, first we will be learning how to do or how to strengthen the neck extensor muscles. I'll just pull up this mid band over here. So this is the starting position where I'll pull the mid band over here, and you just tie up the Thera tube over the patient's head in this position. Just tie up, it will be more easy for you. Just see the position and you just fix it. After fixing it, you just instruct the patient to do the neck extension. Neck extension means the patient will try to extend his neck. How it will be? Let us see. Just do the neck extension. That's like how you will hold. This is the one. Again you will come back to first position. Again it will go back. There's the second. Again go back. Third. It's a 4, 5, 6, 7, 8, 9, 10. So the exercise what we learned now, that is the strengthening for the deep neck extensors. Where the bilateral upper trapezius it contracts, the neck it will go for a extension movement. Now we will be learning for the neck lateral flexors, mainly the trapezius upper fiber. When the origin part of the trapezius upper fiber it contracts, the neck will go for a lateral flexion. At the same time, when the insertional part of the upper trapezius it contracts, the hand it will go up. That's what we call as a shoulder shrugging. Now let us learn how to strengthen the neck lateral flexor. The same way, just pull up the Thera in this position, tie up the Thera on the patient's head, and just hold the Thera and ask the patient to go for a lateral flexion slowly. The patient will go with the lateral flexion like 1, again 2, 3, 4, 5, 6, 7, 8, 9 and over. This is for the lateral flexion range of motion. Coming for the cervical flexion. For the cervical flexion, we will again tie up from the anterior aspect. We have to hold on both the sides and just ask the patient to go for a cervical flexion. That means they will bend their neck anteriorly. Like how? One start. 1, 2, 3, 4, 5. Done. For neck or cervical flexion. Now we will be learning shoulder shrugging, mainly for the lower insertional part of the upper trapezius. That's the strengthening for the shoulder shrugging, mainly the trapezius muscle again. That's the insertional part. We'll just tie up over the acromion process, mainly the bulk of the mid trapezius, and we'll just hold up over here. And the instruction for the patient is supposed to be just keep your shoulder up. That's what the movement is, the shoulder shrugging. How we will do? I'll ask the patient to make the shoulder upward. Now let's do 1, 2, 3, 4, 5. Done. Now we'll be learning for the mid trapezius and the rhomboideus minor muscle, which is just present on the posterior aspect of the scapula, from the scapular border to the vertebral column. Now let us know how to strengthen the mid trapezius and the rhomboideus minor muscle. I'll just ask the patient to hold in this position. Both the elbow, it will be in the same line. It's supposed to be the same line with the acromion process, and the instruction is supposed to be only try to keep both the elbow backward. That means the patient will isometrically contracted to go for a backward movement. How it will be? Just back. 1, again 2, 3, 4 and 5.
3.
So today we learned one of the important topic, that's the strengthening exercises for the neck muscles and the upper trapezial muscle with the mid trapezius and the rhomboideus minor muscle. So hopefully you learned a very important topic, that's the strengthening of the neck muscles. On the next class we will be learning how to strengthen using this same Thera tube or the Thera band for the biceps, triceps and the other group of muscles. Thank you.